Good morning, everyone. Welcome to this morning's Pesca Picks. I'd like to begin by acknowledging that this session is being broadcast from the traditional, unceded, ancestral, territorial homelands of the Musqueam, Squamish, and Stellat'en nations. This morning, our talk will be focused on cultural safety and humility in urban Indigenous research. We are very grateful to have Lyana Patrick join us this morning to present. I would also like to take this opportunity to introduce myself. I will be your host this morning. My name is Tristan. I am Northern Tachoni, and I am the Indigenous Cultural Safety Administrative Assistant here at VCH. With that being said, I would like to pass over to Lyana and allow her to give you a more formal introduction.
Thank you so much, Tristan. Good morning, everyone. Thank you all so much for being here, for spending your precious time to come and listen to this presentation. I want to thank the Indigenous Cultural Safety team for inviting me to present on my research and my work to you today. And thank you so much to the ASL interpreters. Very grateful to have you here too as well. So I am going to, and I wanted to say before I start my presentation that I am joining you today from the ancestral unceded lands of the Musqueam, Squamish, and Tsleil-Waututh peoples, on whose lands I'm a grateful and invited guest, and I'm happy to be joining you from my home today. I am usually up on Burnaby Mountain, but I'm in my home in East Vancouver. So I'm going to share my screen and start my presentation. And I'm going to start my timer so that I can keep an eye on that. I'm really hoping to keep this within the bounds of 30 to 35 minutes, and I'm wanting to keep as much time as we can for questions and comments afterwards. So I am presenting today. The title of my presentation is Skookum Health, Cultural Safety and Humility in Urban Indigenous Health Research. So I'm going to share with you a bit about the Indigenous health research I'm doing out in Surrey, and I will explain what Skookum Health is and is all about. So I just thought I would start with giving you a brief outline of how I would like to structure the next half hour or so. So I want to do a bit of positioning of myself, which is really a practice of cultural safety, of understanding, where we come from and who we are and how that informs the work and how we navigate in the world. So I'll do a little bit of that to start with. And then I think it's important as well to define cultural safety. And what does that mean? What are we talking about when we use that term? And then I'll give you a couple of very brief examples from more recent studies done around healthcare. And then I'll talk in a little more depth about the Skookum Health research and how I sort of see that work as cultural safety and humility in action. And I wanted to share with you some of the community perspectives that have emerged out of that work. And so I want to acknowledge that, many of you probably will be familiar with cultural safety, and there's probably a range of knowledge in the audience today amongst us watching. And so I just want to acknowledge that. And, I hope that you're able to take away one or two things from this presentation that you may carry forward. That's always my hope. So I just wanted to start with a map of the territory where my father's family comes from. So for those of you who know BC or who don't, Vanderhoof is right in the geographic center of the province. And our villages where we come from are located just to the northwest of Vanderhoof. So my dad and my dad's side of the family come from the Stellat'en First Nation. And that is where you can kind of see on that map, it says the Dakelh River. And it's where the Dakelh and the Stellat'en rivers meet to flow into the Nechako River. And I grew up in that area, mostly around Vanderhoof, actually. And I'm also Acadian and Scottish from Yarmouth County in Nova Scotia. And that's a map of Nova Scotia, and that bit in red right there is what's known amongst the Acadians as the Acadian Peninsula. And my family came from this village, fishing village called Tusket, which is actually a Mi'kmaq name, Nikatausket, meaning the Great Forked Tidal River. So I spent a lot of time in Nova Scotia as well growing up. So rivers have always played a huge role in my life. And I live now close to the mouth of the Fraser River. So it makes sense that I'm here. And I just, one more map. My grandmother's French family came from Arishat, which is a village on Ile Madame. And that's just off the coast of, the west coast of Cape Breton Island. And Cape Breton Island is known as Unama'ki in the Mi'kmaq language. So I share this sort of extensive geography and location with you because it's really important, because where I come from and what my family has experienced has really brought me into this work. Both the fact that my father, my grandfather, aunts and uncles, they went to residential school, including the Kamloops Indian Residential School. And so we carry that experience with us, you know, through the generations. But also the privilege that has been afforded me with my Acadian and Scottish ancestry is also an important part of the work. So I'm always mindful of the responsibilities that I have, whether it's to my family in the Stellat'en Nation, to my community, whether that's the urban Indigenous community or communities in the North, but also as a beneficiary of what are known as the peace and friendship treaties on the East Coast. And it's actually something I know very little about, and yet I have a responsibility to that history because that was negotiated between the settlers and the Mi'kmaq. And so as a party to that, I have a responsibility to do some work and understand what my role is in that relationship. And then right up to the privilege of being an academic and what that means in terms of the resources that I bring and the prestige that I get from that and the work that I get to do. So all of this informs how I do my work, the kind of work that I do, which is really community-led research that is grounded in the needs and the priorities and the aspirations really of the community. So with all that said, I just wanted to share a little bit. I'm going to try to be fast on this, very brief history of cultural safety. And again, apologies if this is all, things that you know all too well. But I share this. I worked for about 5 or 6 years in the Faculty of Medicine at UBC, and we developed lots of training materials and resources for students and for health professionals around cultural safety and Indigenous health. So we often would share this kind of stepwise chart that kind of is an evolution of this concept of cultural safety, kind of beginning at the bottom with this idea of cultural awareness, where there is an understanding that there is difference, and moving on to the notion of cultural sensitivity, which alerts people to the legitimacy of difference, and that there is a process of self-exploration that's involved in being sensitive to the cultures of other people and of your own culture, and specifically that life experience and the realities that and impacts that might have on others. And then emerging out of that and extending from that is this notion of cultural safety, which is really, as it says, an outcome of healthcare education that enables safe service. And importantly, I think it kind of shifts a little bit of that cultural awareness and sensitivity from being the person who's providing care. Cultural safety then is really the person who's receiving the care decides that's a safe interaction. So so that concept of cultural safety came out of a conference that was actually held, a hui, as they call it in Aotearoa in New Zealand, held by a group of Maori nurses in New Zealand in the late 1990s. And it was in response to recruitment and retention issues that they were experiencing with Maori nurses. And it's based in the Maori concept of kawa whakaruruhau, which was developed by Irahapati Ramsden. And it's a Maori concept that describes the experience of working with people whose life experiences and cultures differ from those of the practitioner. So as Irahapati and others started to describe this, it's derived from the idea that safety is a nursing standard that must be met, akin to an ethical standard. And we can look at it as a concept, as a framework, as really a way of understanding the roots of health and healthcare inequities. So I just want to briefly quote from a paper that Vicky Smyth and Annette Brown wrote in Nurse Researcher, and they've done a lot of research and work there in nursing, and they've really explored this concept of cultural safety. So cultural safety locates health, quote, within a web of social and political relationships, as opposed to viewing health as the responsibility of the individual or as located within a static belief system. So that is the culture. And I think that's a really important understanding of cultural safety. And I have a really, I've got a little, you probably can't even read it, it's so tiny, but there's a little quote at the bottom there describing like the very early sort of definition emerging out of the Nursing Council of New Zealand, in which cultural safety is the effective nursing of a person or family from another culture by a nurse who has undertaken a process of reflection on own cultural identity and recognizes the impact of the nurse's culture on own nursing practice. Unsafe cultural practice is any action which diminishes, demeans, or disempowers the cultural identity and well-being of an individual. So I just wanted to share, just to kind of ground all of these ideas, just a couple of more recent examples of how this is being deployed, how this is being discussed and talked about. So Bernie Pauly, who's at the University of Victoria, and her colleagues, they did a study that they published about in 2015 that looked at the experiences of patients and nurses, patients who were using illicit substances and in the hospital, and then the nurses who were working with them. And what their findings showed was that illicit substance use in hospitals is often negatively constructed. So it's constructed in a couple of different ways. One, as an individual failing, two, as a criminal activity, and three, as a disease of addiction with negative impacts on the patients who access care, on how they manage pain, and how harm reduction supplies and services are provided. So what they discuss is that a cultural safety approach would do a number of things. So first of all, it would point to the importance of understanding history, and in this case, the history of drug policy and criminalization of drugs that contributes to stereotypes and escalated harms of drug use. Cultural safety would prompt us to reflect on the policies and within the organization, as well as the societal beliefs that impact on the delivery of nursing care. And really importantly, especially to my research, which I'll talk about in a minute, an important principle of cultural safety is to acknowledge patients as experts about their health and social needs and what they feel constitutes supportive care. And they really talk about how that power relationship is really skewed in favor of the health provider. And that really points to the importance of nurses recognizing the knowledge that patients carry within their own bodies. And that they highly value, and the importance of learning from patients about their view and preference for care. Margot Greenwood is with the National Collaborating Center for Aboriginal Health, and she wrote an article about health system transformation in Northern Health in Northern BC, and how she uses a change model that focuses on structural, systemic, and individual levels of change and how they're interconnected and the importance of working for change through cultural safety at each level of these different levels of systems. So she provides concrete examples. This is what I like about her article of how Northern Health is trying to embed this across those levels. So some of these include cultural safety presentations, kind of like this one, facilitated workshops and patient journey mapping, which I find really interesting. I don't know anything really about patient journey mapping, but I thought that was an interesting idea that I want to learn more about. And creating materials for users of healthcare services. So how do patients who do not have good experiences, how do they ask questions? How do they give a complaint? But also the Northern Health has created materials that that are helping them to navigate through the system and to understand what all the programs and services are that are available to them. And then briefly, the First Nations Health Authority is extending this idea of cultural safety to a vision for cultural humility and respect. And so the First Nations Health Authority defines cultural humility as a process of self-reflection to understand personal and systemic biases and to develop and maintain respectful processes and relationships based on mutual trust. And then I think this is where it really extends the notion of cultural safety, because cultural humility involves humbly acknowledging oneself as a learner when it comes to understanding another's experiences. And so I think, that's an important piece to really think about, is incorporating that concept of humility, which is not something that we're generally taught in health profession programs. We're taught to be, the experts. And so I think that's an important addition. So the really fun stuff, I love talking about Skookum Lab. Skookum Lab is near and dear to my heart. Skookum Lab is located on the territory of the Semiahmoo, Kwantlen, Katzie, Kwet'elam, Pequot, and Tsawwassen First Nations, which are all the traditional territories of the nations that are out in Surrey. And Skookum means strong, powerful, and brave. And the goal of the lab is to make Surrey a great place for Indigenous children and youth. So I'm going to describe a little bit more about Skookum Lab, but I wanted to explain how I ended up partnering with them to do this research out in Surrey. I approached the Surrey Urban Indigenous Leadership Committee in early 2020 about doing some research, and also known as SWILC, just to make it less of a mouthful. SWILC is a coalition of organizations that came together to advocate for the more than 13,000 Indigenous people who live in Surrey. And so when I started the research, it was just before COVID. And so that was a really challenging time to start to develop relationships. And so it was really important that I find, that I partner with organizations that were doing all sorts of good work in the community. And the reason that I actually wanted to do some research out in Surrey was because during my doctoral research, I was working primarily with a team in Vancouver that worked with people in the justice system and offered health services and programming for urban Indigenous people. And they worked a little bit out in Surrey. And when I went out to go visit with the folks out in Surrey, I was really shocked to learn about what a fast growing population it was. And yet many of the programs and services were really concentrated in Vancouver. So this is why I saw a role for myself, and particularly starting at Simon Fraser University, to go out to work with partners in Surrey. So Skookum Lab emerged out of some work that was done to think about how to address the fact that Surrey had the highest child poverty rates in the province, as well as this, fast growing community and highest number of urban Indigenous people. And so the intent of my research was to start to establish these relationships and partnerships, and to start to build that trust so that I could get to know people, but importantly, people could get to know me and who I was and what I was doing, to identify the health needs and priorities of Indigenous peoples in Surrey, and really to understand what kind of methodologies we should be using when researching culture and health. One of the exciting things that for me was that a lot of what came out of my PhD research was that culture is very, very important to health. And this was the same thing that was being talked about out in Surrey with Skookum Lab. And so we were really interested in, how do we better understand this then? How do we, what are the methodologies that we use to understand that? And then also to support these emerging community-based leadership networks of Indigenous peoples in Surrey, and strengthening capacity to give voice to urban Indigenous needs and priorities. And my thinking about this idea of capacity has also really changed with this research. It's changed from thinking about building capacity to the notion of bridging capacity, because there is so much that exists in the community, so many strengths and so many skills, and I'll talk about that in a moment. But how do we help? How do we mobilize that, and how do we assist and with that bridging? So as I mentioned, Skookum Lab was really created to address the high rate of Indigenous child and youth living in poverty in Surrey. And it seeks to do this by bringing people together, people who have lived experience, making that experience visible, and honoring the wisdom of the urban Indigenous community. And so the primary objectives were to listen, to understand, to cultivate, to initiate, and to build. And so Skookum Lab actually just had a sunset celebration last Friday, where they're wrapping up 3 years of their work, and they will no longer be Skookum Lab, they will now be Skookum Surrey, because their 3 years of funding from Vancouver Foundation is finished. But now they have this kind of core base of incredible work that will now move forward with various partners and in various ways. I wanted to share this slide about the guide groups, because this was a really important part of how I was actually able to do this research over the last couple of months. So they gathered together groups that represented youth, caregivers, elders, ambassadors, a Métis group, which is new just in the last few months, and service providers. And so what they did was they provided safe spaces for people who identified with each of these groups to come together and to share their experiences as community members, as folks who are taking care of the children, as folks who are teaching the children, as service providers, as parents. Like it really helped to mobilize a huge base of knowledge, again, in a really kind of a safe space. So they would meet with the guide groups, but then they would bring everybody together at various points in the year for what they called campfires, to share that knowledge and to further understand everybody's role within the communities and how they intersect and how they're distinct and unique. So it was through my partnership with Skookum Lab that we were able to do a couple of guide group engagement sessions, which I think would have been really challenging to do if I didn't have this partnership. So this is a bit of an overview of the work that we have done, and I share each of these things with you to sort of hopefully highlight some of these cultural safety principles. And one thing I will say about this work is that I am both interested in being culturally safe in how I do the research, but we're also interested in it as a topic of research. So we were also really interested in asking healthcare providers. How do you provide culturally safe care? How would they like to support patients with culturally safe care? And then also asking the community members, do you feel culturally safe? And what would that look like? But also being really careful, because a trauma-informed approach to this, which is also a culturally safe approach, ensures that you're not doing harm in the questions that you're asking. Especially in the last year or two, we've had a lot of reports that have talked about racism and violence in the healthcare system. And so we don't want to keep asking the same questions over and over again. So I think I think that's why it's really important to partner and have a really partner with community-based organizations and have a really robust advisory and research team who can help to identify those kinds of things and to help you to create a safe space for everybody. So to that end, we convened an advisory committee that included Fraser Health, the Fraser Region Aboriginal Friendship Center, which is the biggest Indigenous organization in Surrey, of course, the Leadership Committee, and then Skookum Lab. And I think that this speaks as well to our acknowledging that change in all of these systems has to happen in partnership with the decision makers. This is something that we felt really strongly was really important, that Fraser Health be a partner in this research as well and be involved, so that they could also sort of take back to their to their institutions and their various levels of management the kind of learnings and the teachings that emerged out of here. So I think it in a way speaks to what Margot Greenwood was talking about in her article about that need to have structural change as well as organizational change as well as individual level change. So we're sort of really trying to operate across those levels. I mentioned the Skookum Lab guide groups. We were able to do 2 community talking circles with members of those guide groups. And then the square on the far right at the top, where we hired a community elder and community research trainee to guide the process. And this to me was this was key. This was such an important part. I can't believe I've actually not done this in my research yet. We've definitely worked with community folks who have organized and worked on their end in the community, but as part of for myself, as part of my own individual research, it was it's been such an important part of my learning and my experiences to have a community research trainee. So as I mentioned, the ambassador groups are one of the guide groups, and the ambassadors are a group of primarily Indigenous women. I think they're all women who are training as leaders in their community. And so one of the ambassadors came on as a research trainee, and it's really about valuing community knowledge and the importance of learning from people with lived experience. But I think so often academia does not value that lived knowledge, because our community research trainee has caught on so quickly to everything we're doing. And really, it's just kind of a language thing. For example, she didn't really know about the institutional ethics board and that whole process that we have to go through for ethics. And she very quickly got it, because a lot of it is common sense. A lot of it is about gaining consent. And then from her perspective as an Indigenous person, understanding how and why that might be a different process for working with Indigenous communities. She understood that very intimately from her lived experience, and the need to develop that trust and to co-create knowledge, which is what we're striving to do. So I think it's just really about, again, it's that bridging of capacity, and then providing some of that knowledge that I think is too often kept separate and inaccessible to a lot of people things like the research ethics and all of the, the types of learning that you get in post-secondary. So making those bridges happen is really important. And then of course hiring the elder to an elder from one of the Indigenous health clinics. I honestly don't think we could have done the work without our elder, because they provided a grounding, they provided guidance, they provided so much to that research. And every single person who we met with at the lab, the guide groups found his presence to be deeply moving and nourishing as well, the teachings that he provided. I'm just trying to think of in terms of time and what I want to share with you. Yeah, maybe I'll just talk briefly about the data analysis piece. I think this is another part about cultural safety, but also this idea, as I wrote about in the little abstract that described this talk, this idea of relational accountability and who you are accountable to. So in terms of, if the goal of this research is to co-create knowledge with the community, then it can't just be myself or the research team taking this data and thinking about it through our own lenses and then doing what we do with it, whether it's reporting it back or publishing or presenting about it. It really needs to be part of a bigger process of co-creation. And I think that's part of being relationally accountable to the people who shared their stories, their experiences, their strengths, and their challenges. And so I think it's really, it's kind of about the process, right, of doing that work. And so for example, this Friday, we've got a reporting back event, which we're calling an Indigenous Wellness Day. And we're going to be sharing, the data that we have, all of those stories and all of that information that we gathered over the last couple of months. And we've invited all of the people who participated back so that we can have, a long discussion about it. We're going to share people's data back with them to make sure that, we heard correctly, the things that were shared. And an important part too of that co-creation collaborative analysis is to have community members be a part of that process. And so, our research trainee, now that the data collection is finished, will continue as a part of our team through to, through this piece as well. And in fact, we've also applied to do some mentorship to co-author. So we want to co-author with the community as well, which is another, kind of area of academia that I think is also undervalued and underexplored. Often it's that kind of sole authorship is the end goal. But for me, it's to really kind of share in that process more widely. So I just want to quickly kind of wrap up by sharing with you some of the community perspectives. And I think that these quotes really show the need for a cultural safety approach, framework, understanding to health and healthcare, as well as the opportunities that I think are in the community now and can be mobilized and need to be really brought forward. There's so many strengths. So the first quote is, "There's quite a good population of elders in Surrey, and they are not being utilized as much as they should be. There is so much teachings that are going idle, and I think that they should be approached and offered something in order to give those teachings to the people in healthcare systems." So it really speaks to the fact that that there is a knowledge base, and there's also a willingness of people to share their knowledge, in spite of all of the harms that so many people have experienced by those systems. But I think that in speaking and in working alongside Skookum Lab, because the intent of it is to address child poverty and the experiences of children, I think there's this recognition that we need to do this for our children. And this is going to be, this is what is healing to us. This is what is going to support our future leaders and our future community, who will offer so much if our culture can be recognized, can be embraced as, the healing pathway that it really represents. So the second quote, I heard a few things about how Indigenous people are treated in the healthcare system. And just one small experience that I had was with my grandma when we were called in for a meeting. And one of the things I kept hearing the nurses or whoever was there talking, I don't understand why she won't talk to us. And just that understanding of how much my grandma has been through with the system and just everything that Indigenous people go through, and understanding how we can't trust people. So this quote spoke to me about all of those things that I was discussing earlier about the need to understand that history, the need to understand the experiences that people have had within those systems, within, people that have been impacted by racist policies. And that, sometimes what can happen is that in terms of a cultural awareness model, people can look at these kinds of responses as being culturally based. Well, elders are just quiet. They just don't talk as much. And that's kind of a static, fixed understanding of culture. And a much more nuanced understanding would understand that their reactions and their responses are informed by the history and the experience that over generations that Indigenous peoples have had within those systems and those structures that have treated Indigenous bodies with a lot of violence and a lot of racism. So I think, their experience has really surfaced a lot of those, I think, deep issues. And then the last quote, I have to just move this for a moment. We are looking at how we can bring more cultural teachings into the hospitals and into clinics, the healthcare system in itself, because it's kind of difficult to bring our culture, our spirituality into the healthcare system. It's a real fine balancing act to do this, and it takes a lot of time, but we are still getting that pushback from systemic racism. So in spite of the challenges, in spite of the experiences, there is still that desire and that need and that, working towards bringing these teachings into that system. And a lot of people talked about that and described it as being like a balancing act. And I think that's because we're bringing our own Indigenous ways alongside living in, a Western culture, and it's not that Western medicine, needs to be discounted. It's obviously a really important part of our health and well-being, but really it's about providing those like multiple and diverse pathways towards healing that have been shown, I think, through a growing body of evidence, are keeping Indigenous peoples healthy and well, and supporting their well-being. So I just want to say, Masi Cho, big thank you for spending the time and listening, and I'm really happy to answer any questions or hear any comments that you might have. And I'll also leave my my contact information that you can always follow up if you like. I'm happy to continue the conversation. So, Masi.
Bless you, Cho. Thank you, Lyana. We're so grateful for all of the perspectives that you were able to share with us this morning. Even from your first few slides, I was able to start making some connections. I know as you were wrapping up, you mentioned that we are coming from our own Indigenous ways and bridging that alongside Western culture. As you were sharing the map of the territory from which you come, I thought of a quote that I read recently in Grading Sweetgrass, and it was, "I was raised by the river." And this really got me thinking about positionality and how we have that perspective of the land is raising us. We're not just literally beside a river. So thank you again for sharing all of your slides with us this morning. I'd like to also share some of the questions that we have been receiving here in the chat box. So we're going to get started with, how can healthcare practitioners, both frontline and those who work behind the scenes, incorporate cultural safety and humility into their work?
Yeah, thank you for the question. Yeah, and I sometimes when I think about this question, I think about the challenges of doing that work, because a lot of the things that I've talked with colleagues and students and healthcare practitioners themselves over the years is, there are some basic things that need to happen, including developing a relationship, right? And the challenges, of course, in our current system is time and having heavy caseloads and the very structure of how healthcare practitioners get paid for the work that they do. And so, those are kind of the challenges to doing that work. But in terms of having a good outcome, in terms of having the person who's receiving the care feeling that they have had a good experience, is feeling like there is a connection there with a healthcare practitioner, feeling that they are heard, feeling that they have been listened to, feeling that they will be respected for who they are and the knowledge that they have and bring to that place. And so I sometimes I think about my own personal family experiences in healthcare and in the hospital setting particularly. My dad, for example, has various health issues, and he has had the experience of being in the emergency and of feeling extremely disrespected, of not being heard. And he has gotten up and left. He's gone AMA, as they call it, against medical advice. He's left the hospital. And that's a really dangerous thing to happen, because when that happens, your health needs are not being met or not being looked after. And then, very recently, here's a good story. He had to go to the hospital in the middle of the night. They're about an hour and a half away from the nearest hospital. So it can take some time to get there if you have to wait for one of 3 ambulances in Fraser Lake. And he ended up at the hospital in the middle of the night. And there wasn't really anybody there. So the doctor actually had the time to spend with him. But my dad shared with me later that he had such a good interaction with the person, because they listened to him. They respected when he explained what was happening, what he thought was happening. And it was a really good interaction. And so I think that, that's the kind of practice that's going to make a huge difference. And I just, to go back to my experience in the medical school, I would, a few times I had the opportunity to work with advanced medical students, 4th year medical students who are learning and practicing that patient-provider interaction. And it was a really difficult thing to work with, because I was trying to explain that really the most important thing is that they come back and see you again, right? So you just want to, even if you just share one small thing about yourself, you know, it's really about that relationship and trust. But oftentimes it's really about the medical issue that is being presented, and sometimes an emergency that, you know, obviously that's an important one. But if the person leaves or if they never come back, that's going to be a far worse outcome. So there's that. And then, you know, the whole education piece, you know, I do believe that the sannyas training, the cultural safety training that's offered is a really important component of transforming healthcare and healthcare delivery. Because if we don't have the opportunity to learn about the history, to learn about how history continues to impact us, and if we're not able to kind of do that work in a safe setting where we can talk to other people about it and have that be a facilitated conversation, I think it's going to be really hard to make that shift, because we can really, I think we need to learn about this in community alongside other people who are maybe going through a similar process of reflection and being able to reflect on where we come from, the fact that we do have power dynamics, the fact that we do have principles and values that inform how we see the world, and therefore, and not to pass a judgment on that, but just to understand that this is where, you know, we come from. And I help my students with this all the time, and really to just kind of surface it so that we can talk about it. And it's difficult. It's not easy work, for sure. Sorry, long rambling answer.
Thank you, Lyana. What I was able to take away from your answer is the importance of acknowledging that ICS and cultural humility is an ongoing journey. So it's something that we are always going to be learning about. There's no end date to this. We can always find something new, find new perspectives, and continue that process of learning from those around us or learning from courses. For example, folks who are staff members at Vancouver Coastal Health are more than welcome to email ICS training at bch.ca, and I can send you a copy of our registration form for the Indigenous Cultural Safety Foundations course that we have available here at BCH. Just going to take a moment. We have a lot of gratitude showing up here in the chat box this morning, Lyana. So many folks are very grateful for everything that you have shared and all of your teachings and just the perspectives that you were able to communicate through your presentation. As you were speaking as well, I was reflecting back on your presentation a little bit more, and I just wanted to share that I really liked the way that you illustrated capacity building as bridging capacity. I think that is something new that I learned this morning, and I think that is very important to look at, because it illustrates that concept of moving along beside the folks you are working with and not just doing that work on your own. So as you shared in your presentation and as you shared in your story about your father, that importance of actually taking the time to listen and honor the words of the folks who you are working with.
Yeah, thank you, Tristan. And and thank you for all of the comments. They usually kind of pop up in the chat, but I'm actually glad that they're, to know about them, that they're there. And I really want to, I'm sort of digging around for these notes as we speak, because I want to, oh good, they're right there. acknowledge that I actually learned that from Charlotte Loppe, which I meant to say this, at a gathering that we had, I guess just last week, about this Fraser Salish Region Indigenous Health Showcase. And I just, yeah, I love that when she described that capacity bridging. And she talked about trainees as immeasurably valuable. And I couldn't agree more. And I know that this notion of, engaging and involving the community is not new. It's been around for a long time. But I really do love I guess it's just looking at the strengths. Our research trainee, she's been on both of her children's parent advisory committees. And, like when she knows how to advocate and she understands the dynamics of working, with a group, and she understands like the structural and systemic issues involved because through the education system. And so she has so much knowledge that is so relevant and so transferable. And I just think that in terms of looking at it like that, I've been sort of struggling a little bit because I want to encourage her to maybe and to assist her on the journey into post-secondary if she's interested. And I sort of feel like at the same time, I'm like, does she need to do that? Because she doesn't need those letters, but why not? Like, why not bring together all the best that we have to offer? This is always how I feel about it. It's really not discarding things thoughtlessly. Like we can bring the best of our worlds together to really produce something that's very different for our children and the next generations. And just another thing that Charlotte mentioned was around the notion of humility, which, we've spoken a little bit about today, but, she talked about how we do not have a right to do research. And I really also appreciate that because I think it's hard for us to hear, especially when we've gone through years of training and put so much of ourselves into learning and studying and doing all of this work. And there can emerge the sense of entitlement, but we actually, under a humility framework, we do not have a right to do that research, and we don't have a right to people's stories either, say, in that healthcare system and setting. When we're working with patients, we don't have a right to those stories, but we have a responsibility to develop the relationships and the trust that may lead to learning more and hearing those stories. So it's just another, I think, crossover area between kind of research and practice and an area of convergence.
Thank you, Lyana. For folks that are interested in learning a little bit more about Indigenous research, we do have an Aboriginal Health Library here, and folks are welcome to take a look and to borrow the books that we have available through this particular resource. I'd also like to share, again, reflecting on your presentation thus far and the importance of community. I'm really happy that you were able to share some additional resources throughout the Lower Mainland, and that you were able to share about how so many resources are focused within the Vancouver area. I think that it's important that folks take the opportunity to look beyond their own catchments, as many folks do move quite frequently.
Yeah, and thank you for pointing out, because I say Sanyas and I know it's PHSA, and there are so many other things that are happening, which is why I kind of pointed out Northern Health, but I know that your team is working on so much as well. So just, yeah, casting a wide net, there's always something to learn. And I really embrace that teaching. We always have something to learn from others.
Mm-hmm. with that being said, Masicho, Lyana, Masicho, thank you to our wonderful ASL interpreters, Jillian and Lily. As always, we are so grateful for your assistance in the Pesca Picks series. We would like to also share that our next session will be occurring on June 29th. So please keep an eye out on the Eventbrite pages, as well as the news stories for more information on how you can register for our next session. Thank you. All my relations.
Thank you for your time. Have a great rest of your day.